I want to talk to you today about gastroesophageal reflux disease, otherwise known as GERD, and commonly referred to as just acid reflux. Acid reflux is when stomach acid and sometimes food contents flow back in from our stomach into the esophagus. Acid reflux is quite common and can happen in normal, healthy adults, usually after a large meal lasting a short period of time. Those who have gastroesophageal reflux disease usually experience bothersome and prolonged symptoms due to increased acid exposure for a longer period of time in the esophagus. Symptoms of gastroesophageal reflux disease include heartburn, which is a burning feeling in the chest or upper abdomen, dysphagia, which can be trouble swallowing, regurgitation, which is when stomach acid and undigested food can travel back up into the throat from the stomach, and sometimes hoarseness of their voice. The diagnosis of GERD can be made clinically, which means based on your symptoms and risk factors after other serious conditions have been ruled out. Sometimes a provider may try a medication, and if that resolves your symptoms, GERD was likely the cause. There are two main treatment options for GERD, with the first being lifestyle modifications. These include things such as weight reduction, tobacco cessation or quitting smoking, avoiding triggering foods such as caffeine, alcohol, chocolate, greasy or fatty foods, tomato-based foods, and spicy foods are some of the common triggers. The other way we treat gastroesophageal reflux disease is through medications. Some medications can be found over the counter, other medications require a prescription. These medications work to either block or reduce acid production in the stomach. Your provider may choose a medication based on the frequency and the severity of your symptoms. If GERD remains untreated, it can lead to more serious complications. These include erosions or ulcerations of the esophagus, strictures, which is scarring, and Barrett's esophagus. This is a change in the cells of the esophagus. This change in cells can carry a small risk of transforming into cancer, and Barrett's esophagus requires more frequent monitoring. Further options to evaluate GERD include EGD, otherwise known as an upper endoscopy, pH monitoring, and esophageal manometry. All of these options are available here at Holland Hospital. If you have any other questions about gastroesophageal reflux disease or would like to schedule an appointment, please call our office.